Health Association, and the National Medical Association. Healthy Food Action is a 3-year-old network that educates and empowers public health, dietetics, nursing, medical, and psychology professionals to be advocates. Advocates for policies that will bring about the farm and food system that Americans want, systems that are both healthier and more sustainable. Making sure our webinar today runs smoothly is my colleague, Rachel Gruelle. I'm David Wallinga, today's moderator and the director of Healthy Food Action. We're so pleased to have today as our kickoff speaker of the series, Dr. Shiriki Kumanyika, the President Elect of APHA, and long one of the nation's leading researchers around food equity and health. And in just a minute, I'm going to introduce Dr. Kumanyika, but I want to say a few words first about why this webinar series. In public health for a long time, we've been talking about the social determinants of health, and by that, generally, we refer to the social, the broader social, physical, cultural, and other environments, including the food system that surround us as we live our lives. But in parallel, there's been another evolving conversation around food justice, and much of that is taking place at the ground level in communities, often motivated by considerations other than health per se. And so one of the points of this series is to try to bring these two worlds together closer, to bring together people who think about the food system in food justice terms with the people in public health who think about the same set of issues but often using different language around social determinants of health. I can't think of anyone better to kick things off than Dr. Shiriki Kumanyika. She's a professor of epidemiology in the Department of Biostatistics and Epidemiology at the Department of Pediatrics, University of Pennsylvania, Perelman School of Medicine. She's also an associate dean for health promotion and disease prevention, serving as a senior advisor to Penn's university-wide public health initiatives. Shiriki has a unique interdisciplinary background that integrates her training and experience in social work, nutrition, epidemiology, and public health to address these really weighty issues around obesity prevention and diet-related chronic diseases and health disparities. And I'm sure you can all appreciate that with these systems issues, that interdisciplinary approach and training is so critical. Now, we'd planned to have a second speaker today, Dr. Cecelia Martinez. Cecelia is the research director at CEED, the Center for Energy, Earth, and Democracy in Minneapolis. And you'll see her bio on our slideshow as well. But we're having trouble getting Dr. Martinez on the line. She may be joining us late, so we're going to have to play things a little by ear in terms of whether she's going to join us as the second speaker. Now, just for some logistics. After our speakers, we'll have around 25 minutes of questions and answers, but don't wait to submit a question. The earlier is better. Just look for the box in the right-hand menu of your screen that says Enter Question. Type your question and then hit Send. It'll go to Rachel, who will collect the questions and prepare them in an order that the speakers can address. And now for the first of our speakers, Dr. Shiriki Kumanyika.
Hello, everyone, and thanks, David. I'm really delighted to have a chance to share some of my ideas on this topic. I'm going to talk about some of the challenges of eating well from a public health perspective, with a particular focus on achieving health equity. This is National Public Health Week, and the theme of the day is eating well, as you probably know. So I'm going to take that topic but look at it from more of a public health view than an individual or clinical view. I'm going to begin by talking about what we actually mean by eating well, referring to a summary of the U.S. Dietary Guidelines for America in 2010. If I could have the next slide. Just a minute to show you, but what the dietary guidelines look like. Thank you. So what constitutes eating well has remained relatively constant since the advent of the dietary guidelines back in 1980, and these guidelines are directed toward chronic diseases, the diseases that have been become the major causes of death and disability. We've refined the guidelines as we've learned more about how the dietary pattern affects these chronic diseases, and the 2010 guidelines, which are shown here, have three main elements. For the first time, they have a specific guideline to control total calorie intake to manage body weight in response to the obesity epidemic. So eating well in terms of the types of foods is not enough if the amount of food is more than one can afford in terms of controlling weight. And then there's a list of foods and food components to reduce nutrients that you're probably familiar with from nutrition labels or other ways, the salt, certain types of fat, sugars, and then foods that contain these foods and that contain refined grains. And at the right-hand side of the slide, what we're recommending is that there are increases in vegetables and fruits, whole grains, certain types of protein foods, especially the ones that are lower in solid fats and calories, or sources of oils like certain fatty fish, and then at the bottom, to make sure that they're foods that provide essential vitamins and minerals. And this is sort of summarized in the graphic, my plate. The main piece of this is half of your plate should be fruits and vegetables, and less of the animal products and so forth. So that's what we mean in public health by saying eat well. People might have other versions of it, but that's the one that's going to be the focus of my talk. So I think we're now in what I like to call a paradigm expansion, where we still really work on advising individuals about how to eat well, but we also realize that there's a lot more going on than an individual's lack of knowledge about what to eat or a lack of caring about their health when it comes to food selections. We recognize that the environments in which people choose their foods are a big part of the issue, and I'm going to focus on community environments. Next slide, please. And talk about how public health professionals and researchers have begun to really try to understand this aspect of the food system. So what I've listed here are a set of domains within community retail food environments. I'm not going to talk about school food or worksite food or community centers, although those are important topics. But what can people buy when they're shopping for food out in the community, and what kind of options are offered in those retail outlets? So there are lots of different types of supermarkets, and when one studies this, you get more and more detailed into looking at supermarkets, which are important because the access to healthy food depends on the type of store and what's inside the store, and sometimes you can get a hint of that from the size of the store or the retailing model, whether it's a warehouse store, a super center, or a big box, or a smaller grocer, and then you have corner stores or neighborhood stores, street vendors that sell fresh food. And on the right-hand side, you also have different types of restaurants. You have street vendors that sell prepared food, and sources of fruits and vegetables like produce markets or farmers markets and community gardens. And so that's the community food environment landscape that people are dealing with. There are lots of choices. Most food dollars are spent in supermarkets. I think the figure is about 75%, although that could change as we begin to look at creative ways to get people access to foods, more access than they have now. Next slide, please. So from the perspective of the American Public Health Association in particular, I wanted to emphasize the key principle that food-related pathways are absolutely fundamental to achieving our national public health strategy. This is the government issued Healthy People 2020 goals. There are 4 of these goals, and all of them relate to food in some way. We need food to follow the dietary guidelines, for example, to improve the ability to prevent disease, disability, and premature death. Next. The second goal, achieve health equity, eliminate disparities, and improve the health of all groups, and that's where I'm going to focus today. Next. Create social and physical environments that promote good health for all, which relates directly to the ability to achieve health equity, which results from disadvantaged environments that impact upon the way people live and can participate in society. And the fourth goal, which is clearly related to food and eating patterns, again, is to promote quality of life, healthy development, and healthy behaviors across all life stages. So food access and the kinds of food that are available should improve people's quality of life. It's not about eating a medicinal diet. It's about having a food system that really brings to people food that's good for their souls, so to speak, as well as their health. Next. I wanted to explain a little bit more about social disadvantage because I'm going to use this term quite a bit during the rest of the presentation. Social disadvantage, as defined in Healthy People 2020, and I was involved with the Healthy People 2020 process as an advisor, we wanted to make it clear that when we talk about equity issues and social determinants, we're trying to focus on people who have unfavorable social, economic, or political conditions based on their relative position in social hierarchies. So relevant here, racial ethnic minority populations, low-income communities, rural communities, for example, have some systematic differences in their ability to participate in society because of some of the conditions in which they live. Next. So during the remainder of my talk, I'm going to highlight 3 challenges that I've identified as key challenges for improving food landscapes for socially disadvantaged populations. And I'm hoping that by the end of this talk, or at least by the end of the seminar with the questions and answers, you'll be able to explain how physical, economic, and social cultural influences in food environments might limit people's ability to eat well. I also hope you'll be able to identify the challenges, at least one or two of them that I mentioned, that we face in taking public health action to remedy the situation. And I have in italics because I'm not sure if you'll come to this by the end of this particular webinar, but there's a whole series, and maybe by the end of the series, you'll be able to suggest at least one potential strategy for improving the potential for food environment equity so that people have equal chances to make healthy food choices and eat well. Next. So challenge 1. Food availability in socially disadvantaged communities makes it particularly difficult to obtain healthy food. And I'm going to illustrate that, not with a lot of data, but telling you about some of the data that have been compiled on this issue. Next. I'm going to talk first about physical environments. There is a very convincing evidence base that shows physical environment conditions that are less favorable in socially disadvantaged populations. I have studied in particular African American populations, but this is also true for Latino populations and for some others to the extent that we have data, or perhaps if we don't have data, we should look more carefully at the environments of some populations in the rural areas, for example, to really document what their physical environments look like. We know that there are fewer supermarkets and healthy food stores in communities of color, in low-income communities, and in rural communities. Limited availability of fresh fruits and vegetables. And at least in the inner city areas, in the black community, there are more fast food outlets, and so you get a mix where there's less of the healthy food readily available and more of the less healthy food that is available, driving people towards a set of unhealthy choices. And there are more outdoor advertisements for fast food in the physical environment. These are the things on billboards or on the side of buildings and so forth. Then there's the economic environment. The main driver there is the cost of healthier foods. And the data don't really show clearly that there are inequalities or inequities in cost of foods, that the people in low-income communities pay more or for certain products, but the cost of healthier foods has to be thought of relative to how much people have to spend on food. And so the cost is always going to be a consideration. People are very price sensitive, and as you go down the income scale, they are extremely price sensitive. So if healthier foods cost more, which is documented in some studies, then the cost is going to be a problem for eating well. Another thing that's interesting is that when the cost is lowered, it's often lowered on the least healthy foods. So you see, deals, dollar menus, and so forth, advertising and exhorting people to save money by buying, certain types of foods. But the healthier foods are not always on sale. They're much less likely to be on sale as far as the data that we've seen so far. And then the third economic variable is the benefit, the economic benefit to communities of the jobs and the sponsorship that comes from certain companies that make unhealthy products. And this includes alcohol and tobacco, but also certain food products. The third type of environment is the message environment. And I'm going to talk about that more under Challenge 2. But just to say here that there is really more evidence that you'd like to see. It's too easy to document that the advertising and promotion of sugary beverages, fast foods, and some other types of unhealthy foods is more, it's heavier advertising to socially disadvantaged communities, particularly African American communities, and some data on Latino communities that I've seen. Less well documented that advertising can be targeted by income, which is a good thing because you can't identify channels for advertising people strictly on their income, but you can identify channels to advertise to people based on their race, ethnicity, or their language. Black youth have, and Latino youth also have higher media use than their white counterparts, and so their exposure to the advertising that comes through TV or through the internet is going to be even greater. There's already more advertising, and then they're going to see more of it. This advertising is ethnically tailored to be particularly salient to the targeted populations and to really resonate with their identity issues, cultural values, and what's familiar. So it can be very, very effective in selling the products that are less healthful. And again, it's not focused on the healthier products. Next. This slide deals with access to healthy food. Two resources for looking at issues of access are the fairly recent CDC analysis, Centers for Disease Control, where they looked at access to healthier food retailers, taking the types of stores that are most likely to sell a variety of products and fruits and vegetables and healthier products. And the other resource is the USDA's Department of Agriculture's Food Environment Atlas, where you can actually go on. I put the URL here. You can go there and click on it and find your community, put in your zip code or something and see what kind of food access is there. And what the food access data show, I've already mentioned in general terms, is that there's less access in certain areas and certain census tracts. I think in the CDC disparities report on the left, the difference in rural communities and urban communities is something like 50% versus 20% without a healthier type store within a mile or within the census tract or within a half mile of the census tract. On average, and this is for the U.S. as a whole, about 30% of census tracts don't have a healthier store, and then that percentage is higher in communities where there are more people with lower education, and in data, not this government data that's being analyzed here, but in data analyzed by various researchers, there's a lot of evidence that even when you get down to finer definitions of healthy food access and look at communities at a more granular level, you can really see disparities in access to healthier foods in the different communities. Next, please. I wanted to point out that the difficulties of finding food and having to search harder for it if you're in certain communities, especially affordable food, is a problem in the U.S. as a whole. So this slide is about the whole U.S. population. It is an analysis of the food supply based on something called the Healthy Eating Index. The Healthy Eating Index picks up on the 2005 dietary guidelines. I don't think this analysis has been updated for the newer guidelines, but the point is the same. In fact, this is probably a best case because the 2010 guidelines are more stringent. So there are three elements to look at. In the blue, you see the index or the sort of dietary quality of dollar store menus. If you look at the red, it's for the whole food supply. So dollar menus, not dollar store menus. So the dollar menus are like the sausage and egg biscuits or whatever was on the menu at fast food restaurants that had these dollar menus. What could you get for $1? And then the other is the whole food supply. And the green is the optimum score. That is where you'd like to be. You'd like to get the highest score possible in the category. If you're looking down there at DGOL, that's dark green, orange, and leafy vegetables and legumes. So it's a category of vegetables in case that's not clear. So you can see that we're not, where the green is far away from the red and blue, we have a long way to go in the food supply providing us with what we need in terms of a certain balance of food. So what this means is that not only do the types of food available, they're in a different proportion, so they're being sold and given to the population in a proportion that doesn't align with what's recommended. But the fact that some of this goes against instincts because we love fat and sugar and salt, it's really very hard for anybody to follow dietary guidelines. And then it's harder in communities that have access issues and, as I'll show in the next challenge, and who have more of the promotion of the unhealthy foods. Next, please. So the second challenge is promotion. Food advertising and promotion drive consumers toward high-calorie, low-nutrition foods using strategies that are social, culturally, and economically tailored. And this particular illustration that I had shows a one-to-one correspondence between a fast food ad and one for 5 a day, eat your fruits and vegetables. You may not be able to see the little 5 a day symbol at the lower right of the second billboard, but there's far from a one-to-one correspondence in terms of the amount of ads that people see for healthy and unhealthy food. This slide is used a lot because it shows this interesting juxtaposition of these two ads right next to each other. But on the next slide, I'm showing you some data from a Federal Trade Commission report on marketing to children, which provides some public domain data that details what we're up against with respect to commercial advertising. I've included just one slide from that report, but I have the URL if you're interested in the whole report. And this graph shows the millions of dollars spent on advertising just to children and teens on various types of products. So at the left, you see the highest amount of money spent on advertising restaurant foods, and at the far right, you can barely see a little blip in terms of millions of dollars spent on fruits and vegetables. So the healthier products that you'd look for, maybe some of the dairy products or the fruits and vegetables, are much less likely to be the focus of advertising dollars, which suggests that there's very little advertising for the healthier products, and this has been seen in time and time again in studies. The difference in the color within each bar is just showing you that it's advertising to children or to teens, or it's both when it's kind of cross-hashed. It's just overlapping. Both children and younger children and teens would be seeing that. Next slide, please. I've mentioned the target marketing to consumers of color, different ethnic groups, and I wanted to give you a couple of examples. I mean, this topic is certainly a topic in and of itself, you know, what it is and what one could do about it, what one would want to do about it. But here I've just given you a couple of examples so you can see what I mean by ethnically targeted marketing. The first is showing two fast food companies targeting African American youth with advertising and on the internet, websites, and banner ads. The African American teens in this particular study saw 75% more TV ads for McDonald's and KFC than the white teens. That comparison shows that where these ads show up, which TV shows, which websites, and how they are formulated, is reaching more, when you use, you know, Nielsen rating data and so forth, is reaching more of the African American teens with ads for those products. The second example is really physical presence in the community. Pepsi sent 6 vans and 6 trucks carrying DJs and soda products to black and Hispanic neighborhoods in 22 different cities. Vans and trucks went to schools, parks, basketball courts, and asked audiences to sing and rap for Mountain Dew items, and gave out bottles and an offer under the cap for another free bottle. There are lots of these examples. It's public information. It's not something that's hidden, even though from a public health point of view, it may seem that you know, it's unfair or whatever. This is perfectly legal, and it's actually targeting is normal business practice, and so we have to decide, and communities have to decide, is this something that's a justice issue? Should we not have more promotion of foods that are healthier for people? Maybe we can have something in the Q&A about this topic. Next slide, please. So the third challenge has to do with the social context, and I think this is probably the least well-described challenge of the ones that I've talked about. What I'm referring to is that the characteristics of a community and the characteristics and attitudes and experiences of people in the communities influence the appeal and the effectiveness of messages and approaches for environmental change. I have some examples of what I'm talking about on the next slide. So if we're thinking about intervening in a community to try to improve the food landscape, we have to be aware that income and education are going to influence what people can purchase. The education and whether they have a car, how much time people have, is going to influence how much searching they can do, how they will navigate the food system that they have you know, in their communities, even if the prices are fair, which I've mentioned before. So that's one factor. We have to realize that solutions have to be affordable for people and not put extra burden on them for searching for the healthier foods when they're motivated to do that. Secondly, the message might not seem right to people because the dietary guidelines may appear to be, and sometimes the dietary guidelines are actually contradictory to what people have been taught or what their grandmothers might have been taught about what you should eat. In the 1940s, if you look at a public health nutrition text, people are talking about making sure to eat enough meat and foods with iron and vitamins and so forth. And so the new dietary guidelines may contradict what people really think is the right thing to eat and what's been codified in their cultural traditions. And that's going to be something to consider when trying to look at the food landscape. What kinds of foods do people want? What foods do they think are healthy? The third is that the opposition may turn up the heat if you consider people who are trying to sell unhealthy foods to be the opposition. If communities, the low income or communities of color are a large part of the market share, if they're important consumers to a company, when public health goes in to try to reduce something, then the companies may come out and fight, and they often have better resources, it's an understatement, than public health professionals. 4, economic needs, and I referred to this earlier, may drive the community, people in the community or the policymaker to think that what's in their best interest is to keep those businesses in the community. And I think that that is particularly difficult when one looks at things like taxing and banning things and so forth. You know, what other resources are going to come into that community to replace something that you may be suggesting for a decrease? And I don't think that that means that the solutions can't work, but I think that the consequences for the community have to be considered so that something is offered to the community in place of something that you might think should be taken away or reduced for health reasons. And finally, cultural attitudes differ about a lot of things, including body weight, and especially people who have experienced hunger or undernutrition, who are looking to become more healthy, may actually feel that a larger body weight is healthier, in some cases more attractive, and won't believe that being overweight is bad for health unless the message is delivered in a way that really is compatible with their views and understanding. Next slide. So we find ourselves having to do a balancing act. It's not as simple as it looked. I know when I first started working in this area, I thought, oh, this is obvious. You know, there's problems here. There's too much of this and not enough of that in the communities, and we'll just go and tell people about it and we'll start fixing it. Well, it turns out that it's much more complex. We have to recognize what communities need, what they see as assets, and their agency in deciding what they want in communities as we formulate our solutions. But we also, I think, have an obligation to point out if we think that there's an injustice or some sort of exploitation going on, so that people have the data to decide for themselves how they want to proceed. Secondly, we risk exacerbating biases about low-income or ethnic minority communities, and we know that they exist. And when we start talking about how bad things are, the disparities, even though we're doing it because we think we're convincing people, we're showing them that there's unfairness that needs to be approached, we're actually reinforcing stereotypes that they may have. So we have to be careful there. And third, the messages about food insecurity and hunger often conflict with messages about obesity, and I think we need to really think through how to address both issues when we look at the food system, so we're not only working on adequacy issues or only working on calorie reduction issues, but we're working on a wholesome, healthy diet at the right level that will help the people regardless of which type of nutrition problem they're experiencing. So I think I have 2 more slides. Next one is one of my conclusion slides. I have 2 or 3. This is a graphical conclusion. So underneath this all, and with David's introduction, we have the idea that there are inequities. There's something unfair going on. There's something that we want to change about the food system. But this is not the same as a housing, civil rights violations in housing where there's actually a law that says that you shouldn't discriminate against people when you're renting a house or selling a house. This is so much more subtle and complicated. So I'm holding that that inequities in the food landscapes are the unfair result of flaws in a system that's actually viewed as equitable. It's a free market system where supply and demand are supposed to basically be the order of the day. The food landscape is it's a function of those dynamics. And the regulations and programs that are in place, and that's what the balance is showing, appear to favor the interests of the supply side more than the demand side. So that the corporations and the large producers and manufacturers and retailers, there are some regulations and protections, but they seem overall that the interests and rights are more likely to be met for the corporate interests or the commercial interests, leaving populations, consumers, socially disadvantaged groups up in the air, so to speak. And what we have to work with, we have the ethical principles on our side, I think, because there should be more equality in the opportunities. But how do we leverage government actors, ourselves or other health professionals, or how do we advocate to actually change things, or how do we think creatively about the system so that socially disadvantaged populations are not as vulnerable to the interests of corporations? Is there more sovereignty or and control people can have over their own food system? So the next slide, which is my final slide, I'm just leaving you with the 4 points kind of reasoning that I think summarize what I've been saying and that we might take forward as we try to think about solutions. So one, that it's not going to be possible to achieve our population health goals without improving population eating patterns. But it's not possible to improve population eating patterns without changing the food system. We can't do it with individual counseling and wagging our finger at people about what they should be eating. We need to change the options in the environment. These issues have particular relevance for achieving health equity because the environments are less advantageous. Accordingly, solutions in this arena should have disproportionate value for socially disadvantaged populations. And I add politically disadvantaged because you can have people with high incomes who are politically disadvantaged in a system that is discriminatory. And if we can lead the way with solutions that work in the least advantaged communities, I think we're more than well on the way to solutions for the population as a whole. Thank you. Back to you, David.
Well, Shiriki, you did a masterful job of raising some really key issues in this whole intersection between food systems and health equity. And I hope kind of framed out some things that we're going to be covering in subsequent webinars in this series. So since we've got a little time, but I want to leave some time for Q&A, let me just respond with a few points. I think that you know, what you did such a great job of framing out are some of the challenges in terms of our thinking and how our thinking is having to change in public health around these food system issues. But you also pointed to some other broad ranges of issues to bring up. One is language, and I saw that you were very careful not to use the term food deserts, which I really appreciate, because I think one of your last points spoke to that, not focusing on sort of what's lacking in communities and maybe unintentionally sort of disparaging or underplaying the resources of those communities that might be socially disadvantaged. And I totally agree with that maybe we ought to be talking more about what it takes to create a food oasis rather than, you know, what it takes to get rid of a food desert. And then I think we've got challenges because the solutions to these problems are not simple, and they're not just either at the ground level or at the national level, but kind of it's a both and. And so, you know, there isn't going to be a one-size-fit-all solution. And in fact, as you said, the solution for one community or even the way that they frame the problems is going to be quite different than another community. And so in our approach as health professionals, we have to both be aware of that but also respect it. As I'm encountering communities here in Minnesota, many of which are Native communities, recent immigrant communities, you know, I might walk in the door thinking that we're going to talk about health as a result of food system issues. They might be much more interested in talking about job creation or economic opportunity or, you know, not feeling safe in their neighborhood or wanting, you know, better facilities for kids to ride their bikes. And, you know, those things, all of those things intersect very closely with these food system issues because they're all also social determinants of health. And yet I think it's often a challenge to frame these discussions around what to do about the food system in a way that allows those other concerns to be surfaced. So Rachel, why don't I just stop there, and hopefully you can chime in with some of the questions that are coming in, and also why don't you remind people of how to lodge a question.
Yeah, absolutely. Thanks, David, and thank you, Shiriki, for your wonderful talk. So at the bottom, I believe, of your GoToWebinar platform, there's a place for you to enter questions, and we have quite a few logged in here, so I think most of you understand how to do that. So keep sending them in, and we're going to start asking Shiriki to respond to some of your questions now, and as more come in, I'll try and hit as many as possible before the end of the hour. So the first question, Shiriki, comes from Sarah Timmons de Gregory, and it is, the ethnic marketing slides are very striking. How do we inform communities that they are being targeted as city government and public servants with limitations based on funding streams and potential litigation from big beverage?
Okay, so that's a great question. We've been doing some work on actually how do you talk to communities about the fact that they're targeted. Because, as I implied, it's not so simple as telling people what's happening to them with our lens. What we found to our surprise when we started looking into this, and we've done this now in several communities by showing people scenarios of different targeting things, the kind of data that I showed, but we try to be more neutral in the way we presented it and just kind of, these are things that happen in marketing, what do you think of that? And some of it is relatively well received by communities because it signals to them that they are being viewed as consumers to be sought after. So we have to be careful in thinking that it's always negative, and we've tried to go in underneath and see, well, where's the tension, you know, is there any tension around any of these things. And so things like stereotyping, if people feel that they're being stereotyped and that their options are being restricted because of some preconceived notion, that might be that would be disliked. How to talk about it, I think, is there are several resources available now, a Rudd Center at Yale, the Center for Digital Democracy, and so forth. So the information has been put together and cataloged in ways that can be given to community advocates, discussed in community meetings and presented. But my caveat is that how it's presented and who takes the lead, who the messenger is, and why you're telling people this, what you expect them to do, has to be tailored to the community. Some are very politicized and will share, say the view that I might have of it right away. Others want to think more about it, what do they like and what don't they like, and decide how it might influence action in the future. I hope that answers your question about how do you do it. I know people don't have resources, but it's really a conversation with communities. It's not something that requires a lot of resources, I think. I'm not hearing anything. Are there other questions? Are we still on the line?
Yep, we have a follow-up question from Sarah. The question is, do you know of any groups that advocate for media literacy to be required at several stages throughout the academic career of children?
I don't know of any such groups. There are some attempts at counter-marketing. It's not clear to me that media literacy as such works in the way that we would like to think it works. If we tell kids and they'll become more sophisticated, then they won't be as receptive to the marketing. But I would say look up the Berkeley Media Studies group, because they've done a lot of work in this area, and can probably lead you to their website could probably lead you to the resources that you might be looking for.
Great, thank you. And we'll have these resources available after the webinar. You'll get these emailed to you. The next question from Karen: as public health advocates, what is your stance on policy and legislation that will manipulate these social and physical determinants of health? For example, in Illinois, we are approaching the sugar-sweetened beverage tax again. Any thoughts on that?
Yeah, I've thought a lot about sugary beverage taxes, and I think where I am now with it, if the community that's being affected will support the tax, I think it could be an effective strategy. And what I understand from some of the initiatives in communities is that support from the community has to be tied to giving something, using the funds for community programs to improve the community. I think people realize that it's a tax, and if they don't see themselves as benefiting from it, but only would have to pay more if they wanted to buy those products, it wouldn't work. But it could be, for a community that wants revenue to improve conditions, it could be a way of generating revenue, and so it requires community support. There's a lot of opposition, and the opposition sometimes is better at convincing community members that it's bad for them than it is good for them. So, those are hard, taxes are hard to pass.
Right. Great. So we have a next question from Jacqueline Wolf-Tice. And her particular interest is in food equity on Indian reservations. She states that commodity foods have become staples of diets in these areas, resulting in extremes in chronic disease rates. So she questions whether or not the policy level is the best place to start tackling some of these issues.
Yeah, that's a great question. I believe there's going to be at least one, maybe more, in the series on Native American communities. David, can you comment on that? Because I'm not the best person to answer that, but I think we may have some information coming.
Yeah, as we were thinking through the series with APHA, one of our clear intents was to hear more from communities of color in all their different variations. So the second webinar on May 28th is going to be stories from different communities that have been recipients of community transformation grants and how they've applied that money to do food environment or food systems change in their community. The third webinar, where the date's not exactly set yet, but it's going to be sometime in September, is going to be focusing on the concept of food sovereignty. And that can play out in a lot of different ways. I think both with food justice, food sovereignty, historical trauma, there's a lot of terms that maybe folks don't have a single definition that they work off of. So part of what we're going to be doing is talking about how to think about these terms in food system terms. So in terms of food sovereignty, which is a term that has a lot of resonance in Native communities and on reservations, there's different dimensions. Part of it is, are we the tribal members helping to determine what foods are presented to the populations? That's one question. Another is, are there mechanisms in place to educate members of the community about traditional diets, which I'm not a researcher in this, but I understand that the research shows that adhering to more traditional diets often can lead to health improvements. So that's an important set of issues. And also drawing distinctions between Native communities in the lower 48 and some of the things that are unique to maybe Asian and Pacific Islander communities. And so we're hoping to get some participation of folks from within APHA, for example, that are active on those issues. And then the final webinar is going to deal with issues around historical trauma. And we didn't get into this today, but there have been a lot of policies, both past and present, that have taken people of color out of the food production sector kind of as a matter of policy. So I'm thinking about this huge drop in the percentage of American farmers that are African American farmers, going all the way back to Reconstruction, and what's the impact of that on today's food system. So LaDonna Redmond is going to be a speaker on that October webinar, talking about historical trauma and food justice.
Great, thanks, David. We can move on to a couple more questions. We have about less than 10 minutes left before the end of the webinar, so we want to get a few more in here for Shiriki. This one's about livable wages. Jessica Cole asks, she states that having a livable wage is one of the biggest factors in health food affordability. What are some of the strategies you have worked on or discussions you have been privy to about ensuring a livable wage for all as a strategy to combat food access issues?
Yeah, I agree with that point that addressing the root causes, the social determinants like income and education as well, is one of the best strategies. I haven't been directly involved in efforts to improve wages, but I don't know if anyone else can comment on that, but I just will definitely endorse the fact that we should not be so preoccupied with the end goal of diet that we forget that income by itself is going to improve people's ability to do a lot of things. I mean, just car access for some people makes a tremendous difference in what they're able to purchase in terms of food and so forth. So I think that the theme of health in all policies and working on social determinants requires, and that's something that the APHA has been, very much involved with. It requires that we work with people who do know how to increase wages. So as a nutrition epidemiologist and so forth, that isn't something that I'm more of a spectator and cheerleader in that. But we need to work with other people who know how to do that, work in economic development, work with community development corporations and so forth. And so I think that would be my answers. I don't know personally, but I know that working on that does require bringing in people who have expertise that health professionals may not have.
Can I just add two things here? I'm in Minnesota, and our governor just passed a new minimum wage bump 2 days ago. And the health in all policies was definitely an approach that came to play there. Our minimum wage is going to go from about $6.50 an hour to more than $10 an hour over 3 years. And it's been interesting, the dynamic around that has definitely included folks from the restaurant industry weighing in, with concerns about how it's going to impact their cost structure, because obviously they shift quite a bit of the costs of employees over to tips now rather than paying up front in terms of salaries. So I think that's probably going to be part of that debate moving forward.
Great. So just shifting topics a little bit, we have a question coming in that asks, at what point does advocating become a means of imparting morality? For example, my sister is low income and feeds her children ramen because it's extremely cheap. How can I offer education about fruits and vegetables without sounding offensive?
Yeah, that's a challenging issue. I think that the basic principle of trying to improve the landscape is to put affordable choices before people, that if they want those choices, they would be able to afford them without necessarily being, extorted by relatives or so forth. I think nutrition education has an important role to play, where people will access that nutrition education depends on, what they're, if they're benefiting from WIC or SNAP, there are educational programs associated with that would explain, hopefully not in a preaching way, but in a way that would be a convincing and salient for a person based on their interest in child health, about what some of the differences are in these types of food. But I do think that some of our work with consumers, when you ask people what they want to buy and what they buy, people say that they buy a lot of things where they can get quantity and it's shelf stable and so forth, even though they think it's not the best thing for them or for their kids. So that's the end of things that I think we need to work more on. We don't really know what the potential is for people to eat differently if they had a different food environment and a different information environment coming in with messages about what to eat. So I want to work on that, even though I think that nutrition education certainly has a place when it can be done well and respectfully.
Great. I think we'll have one more question before we wrap up, and this comes from Dr. Alfonso. And the question is, can you give some ideas of how we as public health professionals can advocate for communities to help them take control of their food system?
Well, one suggestion and area that we've been exploring is to convene consumers to talk about the actual acts of shopping and what they see in their environment, in the stores, and then to also talk with the business people, the retailers, about how they perceive the consumer demand and what they might be able to do differently within their business model. There are people working also with distributors so that advocates can not only talk to policymakers about coming in with regulation, but look at strategies that might involve co-creation of solutions with consumers, talking to retailers, being very specific, because I think the retailers are not the same as manufacturers. I mean, some of the things that happen may be dictated by manufacturers in terms of pricing and products, and then retailers are doing business on the ground, maybe more receptive to what community members want if they come in with, with a menu of possible options. And so those are some suggestions, other than just kind of, everybody yelling at each other to say you're not doing the right thing, to see what can be done constructively and get the community voice out there. People love to talk about this when we've been involved with focus groups and so forth on this, and people love to talk about it, especially when they think someone in a position to change, make a decision to change something, might hear their voice.
Just if I could add in, at a more concrete level, first of all, that's what Healthy Food Action is trying to do, is to help people like the folks in this call find ways to get involved with advocating for policy change. And of course, APHA does that as well, our co-sponsor. So there's going to be venues with the Food and Environment Work Group at APHA or the Environment or Food and Nutrition sections to do some of these things. And of course, with any kind of systems change, there's power in numbers. So individually, it's tough to envision changing a whole system, but whether nationally or maybe even more at the community level, there are a lot of ways to join together through your local public health affiliate. A lot of, like in hundreds of places now around the country, there's food policy councils, and this is a way to identify people in the community that are your natural allies in terms of advocating for policies. In addition, for example, I know Robert Wood Johnson Foundation and the American Heart Association now are working together to elevate certain policy approaches to community change around healthier eating. And I'm sure if you go on the American Heart website, you can be connected to that as well.
Yeah, in fact, I think that Voices for Healthy Kids just put out a toolkit that could be used, and maybe we could, gather up some of these, the web links to these resources, because there are definitely advocacy toolkits that have been developed in this area, and so forth, depending on, where you would want to put your energies. Yeah.
If you go back to the site at Healthy Food Action where we're going to post the rebroadcast of the webinar, we can include some of those links there as well. So I think we're out of time now, and Rachel, if you could just put the last slide up there. I wanted to thank Dr. Kumanyika for a wonderful job and really thought-provoking launch to our webinar series as well. Want to invite folks to also join us for the next webinar on May 28th, again on the community transformation grants and change happening at the local level. You're automatically registered for the other webinars, but please let your friends and colleagues know about the webinar series and how to register for that as well. Note that the rebroadcast of this webinar, if you only caught part of it, or you want to share it with somebody, is going to be posted in the next day or two probably. We also have other webinar series on different topics. Next week, for example, is the last of our food pollution webinars, the tricky case of triclosan, with Dr. Sarah Jansen of UCSF and Beth Schenk on why her hospital has stopped using triclosan soaps and cleaners completely. So you can find links to all this information at healthyfoodaction.org. And I just want to thank you again on behalf of the sponsors for joining us in this kickoff during National Public Health Week. And I hope you look at the APHA website for more ways to observe National Public Health Week as well. Thank you, Shiriki, and thank you, audience.
Yeah, thank you.